for being available to talk at our first open forum. This is our first one I think we've had, which is on or for ages anyway. It's on a subject, a general subject, rather than having a parent consultation. So I'm Jan. I'm the forum coordinator for Family Voice Peterborough. Hello, everybody. Can I just go around and ask everybody to introduce themselves, because we have only got a small group here, but as I said, we may have some more joining us. So I'm going to look at my screen and get them to introduce as I can see. So I've got Kirsty. Could you just say who you are, please?
Hello, I'm Kirsty. I'm the interpreter today.
Fabulous. And that's another of our initiatives, is to have a signer and interpreter available at as many of our events and forums as we can. Okay, Mandy.
Hi, I'm Mandy. I'm a parent rep for Family Voice.
Fabulous. Dr. Reddy.
Hi, I'm Venkat Reddy. I'm a consultant neurodevelopment pediatrician. I'm the lead clinician for the community child health services in Peterborough.
Fabulous, thank you. Ala Raki.
Hi, I'm Ala. I'm a parent in this group, I guess. Maybe the only parent, or maybe the second
no,
parent.
other parent cares.
Nobody else.
Yeah. I have one daughter who's part of Family Voice. Yeah, that's all I have.
Lovely.
Sorry, I was muted. Trying to mute myself.
Right.
My name is Asta. I'm a parent care representative for Family Voice Peterborough, and I have a child with complex needs and disabilities. And my other daughter just bought me a cake and tea.
How nice is that? Thank you.
I know. Next time we'll do meetings here, okay? When the COVID is over. We can have some cake.
yeah, I want cake. I want Asta's cake. Laura. Hello.
Hi, I'm Laura Tilley. I'm a Family Voice rep for Peterborough. Thank you.
And I think lovely Lucy will be joining any second now.
Hi, everyone.
Hello, Lucy. Could you please just introduce yourself?
Yeah, so hi, everyone. My name's Lucy Brumpton. I'm the team manager for the community paediatric team in Peterborough. Nice to meet everyone.
To talk about sort of the health, the CDU and young persons health services that are available in the Peterborough area. So we've got Dr. Reddy here and Lucy here as well to talk about that. I think perhaps it might be a good idea to start by asking our professionals to have a chat about sort of the new initiatives and the topics that they were going to discuss, and then maybe have a question and answer session afterwards. Is everybody happy with that? Obviously, if you've got any questions, that you're burning questions halfway through, I know on Zoom you don't have a little hand, but if you just sort of wave frantically, we'll turn you on. You'll put your voice up and you can ask. Is that okay? So, Dr. Reddy, if you could just talk to us a little bit about sort of the initiatives and about the services that you.
Yeah. Shall I share my screen?
Yes, please. That would be lovely.
Okay. I think so. What I was going to do is talk a little bit about mainly how we changed our services in response to COVID-19, so that we can continue to provide as best service as we can, really. And then you can ask me some questions. As you know, we're nearly 15th of March, we have to suddenly stop providing face-to-face in-clinic assessments and interventions as we used to do. Initial stages were taken up with interpreting the national guidance about what we should be doing, what we shouldn't be doing to prevent infection spreading around, protecting vulnerable children, working with the local education, health and social care to advise the whole system, and also making our offices as well as the clinics more COVID safe. Lucy spent a lot of time removing all the unwanted furniture, creating one-way systems, making it as safe as possible, really. I'll talk through a little bit about the physical health services first, and then I'll talk a little bit about autism services a little bit later, because often we tend to start with autism, we never get into the physical disability services sometimes, really, I think. So when I talk about physical disability services, I'm talking about children with conditions like cerebral palsy, Down syndrome, Duchenne muscular dystrophy, vision problems, hearing problems, that kind of about 80 to 90% of our physical disability caseload. And we provide support, assessment, interventions as a multidisciplinary team. That's pediatricians, and we got specialist nurses, physiotherapy, occupational therapy, speech and language. And we work closely with, of course, education, social care, and the dietitians from Cambridge Community Services. As you can imagine, that is the one most affected because in the past, all we did was in person, in clinic, hands-on really. And some of these children are quite complex. They have a respiratory compromise because they're not able to get up and move around and walk, and there are chest deformities, spinal deformities. Clearly, some of our parents weren't also keen to bring them into the clinical environment in case they might catch COVID. They're at high risk, really. So the way we already starting changing how we provide services for these children. In the past, it tend to be very medical model, just a doctor seeing them all the time, really. We know that ultimate aim of children with any disability is to improve participation. And that's with education and making friends, going out into the community, developing independence, and to be independent adults as much as possible. Doctors alone can't do that, and we can only do that by working with you as parents to make you more independent and supporting your children, and education doing the same, and we do our bit, really. So we try to make our community pediatric team as multidisciplinary as possible. So we recruited more specialist nursing staff and child and family support workers, and try and provide a little bit more emotional and mental health support as well. It's not just about physical health, really. And for example, we recruited Lucy, who is our team manager, who has got a fantastic experience in physical disabilities, worked in places like Tadworth Court and worked with learning disabled children, and was working with East Anglia Children's Hospital as a participation transition lead. So Lucy brings in a huge amount of expertise that allowed us to build better links with the East Anglia Children's Hospice, able to provide more in-house long-term support for parents and the families with life-limiting conditions and the complexities. So that work we started. We also working on minimizing the number of appointments for the children and the families. We know that a child with a quite severe forelimb cerebral palsy, who can't walk, who can't talk, who can't drink and eat, will have something like 30 to 40 appointments every 2 to 3 months, and some of them in Peterborough, some of them in the hospital, some of them in Addenbrooke, Great Ormond Street. And one thing we've been working on is trying to coordinate it and make it a one-stop shop. If they come in once a year to see us, they get to see the doctor and the nurse and the therapist, and if possible, if needed, bring in the education and the social care and tie in with EHCP reviews or care reviews, whatever happening, so that we don't keep bringing people in, really. So that we're already working before COVID. That fits nicely with how we responded to that. That is, if we can do that, can't we make it digital, really? We already had a fantastic, a lot of you, some of you would have seen our Child Development Center. We got very good facilities which are custom built. And we also got a fantastic, huge video conferencing trolley facilities, which we can wheel around to the gym and places like that. So we're making much better use of it. And aim is to minimize the number of appointments, the time families have to take off their work and pull the children out of education. And many of you spent endless hours queuing on Top Road and trying to get into the car park, and then sometimes turn back, and trying to minimize that, really. In a way, COVID has been dreadful, but some of the things that came out of it is thinking clearly how many appointments we need, what is the reason for appointment, what can we do remotely without having to pull children and the families out of it, and only bring children in who need to be brought in for the things that can only be done in clinic and physically. And if you're going to do that, bring everybody who need to see them together. I think that has worked really well for us, and there's a lot of good feedback, and we would like to work with you to get a little bit more feedback on that really. During the lockdown period, we actually brought a street artist and got them painted all. We used to have those blue walls on either side as you go around the reception. They all got fantastic paintings of animals and the birds and other things. I would still like to share it if at all possible. I'll try it again later. I don't know why. I can always share my screen really. So we done that, and there is going to be a lot more investment in digital, and all staff can now work from home. We all got laptops and VPN tokens. We can access the electronic health records from home. And a lot of, we're trying to record a lot of videos for the families to be able to access about how to do physiotherapy or speech therapy, how to change gastrostomy, trying to get as much training as possible without having to come into the room and talk to a lot of people really. So clearly that is not to say that we can do everything digitally and remotely. Clearly seeing people in person, moving the arms and the legs and the joints and examining, that's really, really important. But only do it when we need to do it, and we can't do it in any other way, really. I think that's what we're looking for. And Lucy has been working with our specialist nurses. Some of you know Sharon Daniels, who used to work in a hospital as an epilepsy nurse, who used to work in autos in the past with respite care. And she's leading on joining carefully with what happens in the hospital. They got a new transition nurse in the hospital started recently, epilepsy nurse in the hospital with Addenbrooke's. And we're beginning to do we do the consultation in the City Care Centre, Child Development Centre, and people from other hospitals should be able to join in remotely and able to have that consultation without having to travel to Addenbrooke's or Great Ormond Street or Nottingham, whatever. We're beginning to do that more and more, really, I think. And standardizing anything and everything we can do, that's about assessment frameworks and annual reviews and who will do what for what reason. That's what we've been working on quite a lot, really, I think. Luckily, as far as the waiting lists are concerned, we never had a long waiting list for children with the physical problems for assessment, and that continues to be the case at the moment. And the way we do the assessment now is if you get a referral, for example, suspected cerebral palsy or a Down syndrome or Duchenne muscular dystrophy, all the families get a very good early help assessment, early support panel, all the support comes in. Now what we will do is somebody like Sharon Daniels would review all the records from primary care, community care, hospital, pull all the background information together. Then she would phone the families to get all the background information. And that's for the reviews as well as the new appointments. So they don't have to come and tell that story repeatedly, really. And they also identify who do they want in the appointment. Do they need a physio or an OT or a nurse or a doctor? They choose what the problems they want to talk about, really, I think. And that is really, really working well for us. And that means that we can target who needs to come in. Is it for weight? Is it for physiotherapy? Is it for doctor? Is it for just a general review? That's working much, much better. So probably I'll stop at that point. And if any of you got any questions on the physical side of things, and for example, for vision and the hearing, we actually got the multidisciplinary team clinics, which we didn't have before because it's much easier to do it on teams. So for the first time, we used to have a joint clinic between myself and a specialist orthoptist from the hospital and a specialist for visual impairment. But we didn't have the same for hearing impairment, and we just started it. We had the first meeting of that on Teams recently. So we had an audiologist and myself and a specialist teacher for hearing impairment, and we would all be joining together, planning, discussing children, what we need to be done. And any investigations we do that is coordinated plan, so you don't get 2 appointments for MRI scans and or you fall between and you sequence it and work through that, really, I think. So that's only just started, and our aim is to develop more training for parents, similar to what we have for autism, for Down syndrome or cerebral palsy, and more of making parents a lot more confident about solving problems. And clearly you need support and the help and break from services, whatever. But there's so many families tell me that if only train us a little bit, or train my support network a little bit, and we can able to offer better support for our own children, really. So I want to stop on that for the physical side of things. Has anybody got any questions? Have you had any feedback from you? People like Laura will meet with other parents and the family voice. Is there anything particular you want, rather than me talking about it, just ask me.
Had to attend Emmeline Centre in Cambridge. Will they be able to receive a similar service now in Peterborough?
Oh, you mean in terms of digital offer, Asta?
Yes.
Interesting, because as you can imagine, there is a lot more meetings similar to the autism strategy group about who is doing what and those kind of things. When we had the last meeting, they were actually way behind compared to us in terms of able to do remote consultations and the digital offer, those kind of things, actually, Addenbrooke's, even though you would expect them to be a lot more better at it. But I think they're improving all the time. And for example, there is a new Children's Cambridge Hospital proposal, CPFT and Addenbrooke's working together. And I have a lot of interest in digital health solutions, and the Officer for Digital Health and Technology for Royal College of Pediatrics and Child Health, that is the Children's Doctor Specialist Service. So we are thinking about making that as the core offer, really, so that we want to minimize this spending time on A14 and those kind of things. So I'm working with the lead pediatrician there to make that more, they're getting better all the time.
Oh, that's brilliant, because A14, oh dear Lord, I mean, they fixed the road now, it's getting easier, but traveling all the time to Emmeline Centre is not exactly the easiest thing. And I think a lot of parents would appreciate if they would be able to get the same services sort of around the corner,
Yeah.
And
I think
sometimes when you run out of batteries, you think you had some and then you didn't. And then, where do you go? Because you have to get your batteries in exactly the same place where you got your hearing aid or band or, whatever you opted for, right. So that would make a lot of people's lives much easier.
Yeah, definitely. I think we are actually pushing other services to say that, can you join us on, and also initially when these things happened, the NHS commissioned a video consultation service. It's called Attend Anyway. I'm sure some of you got those email where you click a link, it takes you onto those kind of things. So that was put in an ad hoc manner. But the NHS is centrally looking at different ways of doing similar video consultations. They're going to commission a number of solutions, and they're actually pushing almost every organization to be digital first, where it is useful, really. And that will continue to get better. And we're continuing to, I am now writing to them, they got an appointment with you in 3 months. Do you need to see the child physically and examine them? Is it a matter of having a discussions? Then you could join remotely, and also then we could be there locally. So we have that discussion in the past, if you remember, especially some specialist hospital, I won't name any names, we won't hear back for them 3 to 4 months after they've seen them in terms of letters, what should the local team should pick it up and that kind of things. Whereas we are there together, it's much, much better, really, I think.
Oh, that's absolutely brilliant. Thank you so much, Dr. Reddy, for your answer.
No, we are actually working with commissioners to pick up as a pilot one family and find out their experience of how many people are involved, how much time they're spending, and whether they could drive this process of getting people together digitally with the local services in the room. And that's going to try it out and try to expand it for other families as well. And we'll be very keen to work with you.
That's brilliant. Thank you.
That's good too. Just a point. I mean, Asta, you raised the issue of things like who run out of batteries. You have to travel halfway across the county to go and get them. Is there any way that things like those little periphery items like batteries and things that you might run out of could be available within local pharmacies or a local drop, other services. So somebody just ran out of batteries, they could just literally go down the road, like Asta said, rather than.
Yeah. I mean, I think it definitely for specialist services like that, for example, the Chiswick group, where we look at the hearing impairment, where all the ENTs and others come together, we got better links with them. So I think if there is something specialist like that, if you, somebody like Sarah Brayton, some of you would know, she is the lead for the SENI services, special educational needs and inclusion from the education point of view. And people like Kat Tatton, our specialist speech and language therapist, they have a lot more links with Emmeline Centre, and we should be able to advocate on their behalf and see how we can work it really.
Because that would be brilliant, because a lot of children, for one reason or another, are unable to receive the services that they need in Peterborough. And for example, like we have two different hearing bands and a different hearing aid.
Yes.
And me one time, I thought that I did have batteries, but the wrong ones that I needed. And it's like, then we had to wait for quite a long time for me, it was one of two choices, either to drive to Cambridge,
yes,
or to wait for a week or whatever for them to be delivered. So it's quite difficult like that, I mean, it never happened, it only happened once, but it happens.
I think Asta, it will be very useful if you could, and I meet with people like Louise from Family Voice and Sarah Conboy from Pinpoint at least once every month or two. We had the last meeting only 2 weeks ago. So if you could collate anything like that and put them into different groups, so it could be Down syndrome, hearing impairment, visual impairment, autism, put them into those headings and say, these are some of things we're hearing which could be better. And I think then we can build on it and develop a way of working together. So as you can imagine, I have a lot more control on what happens in Peterborough and the Child Development Centre, but we can facilitate those discussions really, I think. And we can invite people to join fora like this, so from other people like, as you know, Emmeline Centre, to talk about those things really. I think we got about 40 children under the hearing impairment caseload of the consultants. That doesn't mean that is the only group. Those are the ones with highly specialized needing a multidisciplinary team. So we could have a one session dedicated to that particular specialist areas, more people.
Okay, has anyone got any more questions? Oh, hold on, something's happening. Oh, here we go.
Yes!
A big cheer.
Fantastic. I'll do the slideshow. Yeah,
got it.
Fantastic. You can see that it is completely, that corridor used to be there, which used to be plain blue corridor.
Yes.
And we spent, there's a lot of people raised money, and that we got charity called Head to Toe.
Yes.
And we put in a lot of money to make our premises much better in terms of and also because it's quiet, we can do this. Remember, in the past, it used to be so busy you couldn't move around Monday to Friday, 9 to 5. And one of Joe Hughes, our specialist practitioner, worked with one of you might have seen a similar murals in underpasses in Peterborough. I think Lucy might know the name of the artist. He came street graffiti artist.
Yeah.
Sorry.
It's called Nathan.
Nathan,
yeah.
That's right.
And the money actually poignantly was from Sir Captain Tom's fund that he gave the NHS, which then filtered into our charity, which is fantastic. We've got a living memorial to him in some ways within the CDC now, which is really fantastic.
Oh, that's brilliant. That gave me goosebumps.
And also
I can't wait to see it now.
And also we're going to have, a lot of our children with the mobility issues, they don't stand, they lie down or sit in those. So we're thinking of replacing some of those ceiling tiles with living sky, where you can see cloud and sky, and with the birds and those kind of things. You look like as if you're looking at open sky with the birds and those kind of things as well.
Oh, that's brilliant. That sounds absolutely wonderful, Dr. Reddy. That's because, as you said, they can't see those four, so they do. Oh, that's brilliant. That's lovely.
And talking about vision and the hearing, in addition to that, the next step of this is we're going to have some sensory things, and part of that where you can feel and touch, and they will make bird noises and those kind of things as well there.
That's wonderful.
So we talked about these things really. So we talked about the coordinated physical disability clinic and the vision and the hearing services and bringing in the nursing staff. We are highlighting the, we've been talking about physical health, mental health. We need to think about both, that is mental health and emotional support for parents and the children with the physical disability and physical health problems in children with autism and LD. We know that they affect each other. And this is being highlighted now, as you know, due to the COVID. There is a lot more presentation with eating disorders and anxiety and depression. So we are working with the commissioners to see how can we improve the mental health, emotional health of children with the physical disability. And we are thinking of actually training our physical health staff to be able to do some psychological interventions as well. I talk about a recent case we discussed. Young man with the mild cerebral palsy coming to teenage years, couldn't cope with his how he walks and those kind of things, and developed depression and suicidality. After initial CAMS intervention is finished, then we're actually supporting the physiotherapist whom he knows really well to offer some ongoing both physical physiotherapy and physical support, as well as some emotional support. So you don't have to go and see another psychologist separately. That's something we're working on as well, really. So I want to, if you haven't got any more questions on the physical disability, I want to move on to a little bit on the autism, learning disability, ADHD side of things, really. If you remember, we worked very, very hard with Family Voice and the local authority to transform our autism, ADHD, learning disability services over the last 5 years. And I think it is acknowledged that we got one of the best services around in terms of early help and the pediatrician, psychiatrist, CAMS, and the therapist all working as one team, and every parent getting an offer parent training program before the diagnosis and after the diagnosis in terms of a SIGNET or a APEG. And nationally, it is recognized as we are one of the best examples of how to do it together between education, health, social care. Clearly, whatever we do, demand always is more than what we can provide in terms of capacity. And I'm also part of a national research program on behalf of NHS England. So we asked 150 different units to tell us how they're doing the assessments, what the waiting lists are, those kind of things we can learn from each other as well. So it was working fairly well. So they used to come to see the pediatrician after you go through the early support and early help. I will take a developmental history, family history, examine the child. Then they would have a specialist multidisciplinary assessment. In the preschool, they would see the psychologist and the speech therapist in one appointment. Then I would provide feedback, and they had a very intervention designed by the psychology, OT, and speech and language. For the school age, it used to be autism diagnostic observation schedule, SIGNET, and then mental health support. I know that for school age children, they don't get as much in terms of psychological behavior support or the feeding or diet and those kind of things. We're working on that as well. But all these things has to stop March the 15th. And what we did is try to see, and these are the things we're talking about. And the Attend Anywhere is the video consulting platform. That's the one you get a little link now, and you click on it, and you can have a video consultation with me. And we're using a telephone a lot more. And System 1 is our electronic health record provider. They got their own app where parents should be able to use that app to access the electronic health records, video recordings, and upload them. That's not in full use yet. We're thinking of those kind of things, really. Then we looked at how can we do autism assessments if we can't get into the same room to do that very close by play-based or autism diagnosis observation schedule-based assessments. Internationally, there are 2 or 3 different types of remote assessments. And we picked up something called a BOSA, which is the blue one on the right-hand side, where we stay in the room separately, parent and the child comes in, we coach the parents to play with the child, and so that we can do an indirect autism diagnostic observation schedule. NODA is where we send parents detailed instructions about videoing certain scenarios. That's a play and feeding, and they video it, and then we can go and code for the diagnosis of autism. Unfortunately, we couldn't use it. That's an American system. It doesn't meet our information governance requirements. But what we've done is that we developed our own system. So for example, for preschool children now, we send detailed information about to the parents to record video clips of different scenarios of communication, social interaction, and the play. So then speech therapists and psychologists go and watch them and use the same tick boxes to look for signs of atypical communication, social interaction, and behavioral challenges to make a diagnosis of autism. I'll show you how that works now. So now, as you can imagine, if you see the health visitor now, most of it will be video, and you do complete the early support panel referral through the early help assessment, and all those referrals come remotely to us. We work with Susan Ishmael, who does a fantastic job as early support coordinator. And then myself, our psychology team will phone parents to get all the history by phone. Then the parents upload those videos, and then we do a live video consultation with the child and the parent. And we also get up-to-date report from the nursery. So actually, we're getting a lot more good information than we used to do before. If you remember, one of the criticisms sometimes when the parents say, "Oh, Dr. Reddy, your team only saw my child for 30 minutes when the one snapshot, and he or she didn't do this or that and other things. How can you make a diagnosis?" But now parents actually have the chance to record it when they think shows the most difficulties for them, and that's very useful. Then we can do the live on top of that as well, really, I think. And we're doing the feedback by telephone as well at the moment, or by video, and that seems to be very good feedback working well. What about interventions? This is the 12-week package, which goes by week by week, and a lot of them are through Zoom and the webinar. Some of them are recorded by our staff. That's the psychology, speech therapy, and OT. And parents can watch it when they want it. They can watch it again, and they can have the parents and the grandparents watch it again. And there is then week by week we take on play and communication, social routines, behavior. And they can pick a workshop of choice. So that could be play, that could be sleep, that could be toileting, and they'll get a final review appointment remotely by video with the psychology, speech and language, and OT. So that's really comprehensive intervention package. And some of the parents are telling us they actually getting a lot more out of it this way rather than what they used to do in person. First and foremost, they can choose to watch it when they want to watch it rather than having to take time every week at fixed time. I'm sure some of you attended the Signet and APEG, where if you can't make it on Monday between 9 and 11, and also, all the 10 parents used to come up, and it used to be chock-a-block at the car park, and then you can't have your grandparent or your a husband to take time off at the same time. This way, you can watch it together, you can watch it again and take notes, and then ask the questions when we have that one-to-one with the therapist or the group, really. So we're getting a really good feedback. And I'm working with Louise and Sarah from Pinpoint to see whether we can modify that and be made available through Pinpoint and Family Voice for parents to go back and watch it. If they haven't, a lot of the families gone through before, haven't had this before, really, I think. So we're getting a lot of good feedback and working really well. As we said earlier, I'm into digital health and using tools that allow us to able to provide a lot of services without pulling people out of their homes. Chance is still there, and the Keep Your Head, that has got a lot of information about emotional and mental health services, and Kuth.com for the older young people with other self-directed support and some mild form of CBT. They're only going to increase. And we're also looking at some virtual social communication, play-based support. And we're beginning to think about using machine learning and artificial intelligence to support people with the various things, identify where are the problems really. And that is going to be the future that's going to carry on. And we want to work with you to say what works and what doesn't and where we can help really, I think. So that's all I had in terms of presentation. But as I said, it's about the dialogue and the discussion rather than me prattling on about whatever I think. So I want to stop there. Lucy, you want to just come in and just say a few words and see anything I missed?
I mean, as eloquent as ever, so I'm not sure there is anything for me to add, but just to say that, you know, one of my major areas of interest is transition going forward for this year, and also service user involvement, not only from a parent's perspective, but from a young person's perspective. So I'm hoping that as COVID starts to calm down, we can really look at how we do that, meeting all the communication needs of young people and parents. And I just think it would be to take, you know, the CDC looks fantastic. Slightly less furniture because of COVID depicting that's how it needs to be. But wanting to really look at how we utilise that space and make those clinics worthwhile from emotional health and wellbeing perspective as well, that it feels like a safe, warm environment to come as a family for assessment and treatment. So looking forward to hopefully being on more of these calls and having more one-to-one discussions with parents. That's what I was hugely involved with over at Each, and looking at how we support young people to transition from children's to adult services. And that's, you know, a real passion of mine, and how we can get that better from a children's side, but also enabling parents to and young people to take control of their healthcare needs going forward into adult services. So I really look forward to meeting hopefully everybody on a more one-to-one basis.
From the Down syndrome point of view, the couple of things we're seeing a lot more is the obesity. Recently, we got some youngsters who are, as you can imagine, they are bored and cooked at home, and they are not doing as much exercise.
Yeah, I can. Yeah, that's happening in our household. Well, generally, but seeing it as a big problem with my daughter. It's a huge problem.
Good. So it would be really useful to think about what can we do. I know that it's a big problem in general population, not very easy to change habits, and that's even more difficult now because you're not at school, you're not doing physical activity, and they're not. If you're bored, you will eat more. That's that all of us know that bit really. I think that's one thing. What we would actually like to do is we would like you to help us to get feedback from every child and the family that goes through our system, and so that we can see, especially now, we all got used to communicating digitally and virtually, and it don't all how to remember in the past, we couldn't get together because there are no rooms available and people couldn't come. We can build on that sort of things. And probably people like Chloe can help us to, I got some ideas about how to design those quick surveys and directly from young people using the digital tools to engage, and that would be quite useful. And we want to put out as much information as possible. For example, we're redesigning all our website. If you put in CPFT pediatric psychology, it will come out with our new revamped pediatric psychology website with the links to all kinds of both services here and wider. And for example, this morning we're talking about remember, what we don't want to do is to just keep bringing children and the families. We're wondering, why am I here? What am I doing? What is the reason for that? So we're moving away from that. You need to work with you to identify the goal and agree how we're going to measure the outcomes at the end of the 5 or 6 sessions. You only learn to use those tools, but have a bit of a relapse prevention strategy. If I go back into the same position with sleep or toileting, where can I go to get help? I don't have to keep coming back to those are the ways we are beginning to work together now, really, I think.
Yeah, and I think, I think, so my background's learning disabilities as a nurse, but for me, it's all about empowerment as for families. You know, if if the skills and experience are held by professionals, that isn't helpful for families, and you guys are the experts in your children's care more than the professionals. So I think it's about giving tools, giving resources, and then giving a space for those to be discussed or reinforced, and empowering families to feel that they are in control of what's going on, and developing those skills going forward for their young person's care. So but that has to come part and parcel of involvement from families. You know, what is it, the skills that you feel that you would like to develop? Is it around moving and handling? Is it about positioning? Is it about sleep, toileting, or behaviour? And I think the experts are yourselves and should be feeding into those training packages as well.
And I asked my multidisciplinary team last week who want to be on TikTok doing 30, 45-second videos about training and various things. A lot of people put their hand forward, so we can work with somebody like, I know that Facebook's so old hat nowadays. Very few young people go onto Facebook, really, I think. So we want like YouTube videos, very quick, snappy, interesting ones. So families and the children, young people, 2 minutes videos about good sleep habits, or promoting toileting, or improving exercise, a good diet. Those are things we want to work with you, so that you can tell us how best to do that, rather than talking in a medical speak or a nursing speak. Really, that's what we're interested in, I think. And if we can do it together with the young people, our parents, and together with one professional, that's even better. Really. Laura.
Would this be something you'd be prepared to do, almost like a remote webinar or a discussion with a particular group of people, say like the Down syndrome group? We have a large number of preschool children, and then we have children due to go through transition. And I didn't realise transition happened so early. So, it
starts early. It's supposed to start from the time of the diagnosis, because transition is not a single unit. So we're transitioning different things, like preschool to the school, primary to secondary, and childhood to adulthood, that need to start very early.
That for me, the childhood to adulthood, I mean, I've got a 13-year-old, and I've now got to start thinking about her moving into adulthood, and that's such a big shock. So for us, that is an area that we would love to explore, Laura, with you guys.
And I can't wait for a bit of a lapse in COVID to be able to come and support families to look at what would make the most difference for you as a parent to enable your young person to flourish through their growth into adulthood. And but we also know that comes with a huge amount of worry and anxiety for families about young people growing up, because you've had so much else to think about. It almost like it just appears, and suddenly you're asked the question about transition in adulthood, and it almost creeps upon you in a way. So I've done lots of work with the Council for Disabled Children about parent workshops, but they're run by parents on transition. And that's what I'd like to develop in Peterborough, about how parents become experts, and they deliver training packages to other parents on transition. Because
so I say definitely consider us with the local Down syndrome group, because that's something we would definitely want to be included with.
Lovely. And I think for any of us, responsibility, we all don't just get to 18 and can balance a checkbook and buy a house. It comes with layered decision making, layered risk taking, and I think to support parents to be able to feel comfortable allowing young people to take risks, to make decisions, to be in control of medications. It happens early, but it's not about jumping into the adult world straight away, but it's those small steps that can be done on a layered approach all the way through with support, that eventually means that you don't feel like you fall off a cliff edge when you hit adult services, which is what I've worked with families previously, where suddenly everything's changed. So yeah, it's that layered approach to letting go in some aspects, but feeling like there's that training has happened and that education has happened for that young person, so that you can feel like that as parents, that you can do that. So yeah, really excited about that. Thanks, Laura.
Can I just sort of interject there a little bit, because I'm hearing a huge amount recently about two areas. One is PFA, so I think lots of different groups are talking about PFA, aren't they? And yesterday I was at a meeting. I've just circulated this morning the PowerPoint presentation to all the reps to have a look at and to consider. And they're talking very much about exactly what you're saying, Lucy. It's about the transition period, and also what they're trying to do at Caring Together is to put together a tool for parent carers, because all the focus is on the young person, and often, like you said, the parent carer is actually the expert in their child, but they need to have the tools to be able to cope with that transition. And talking about the parent carer themselves, about their futures, you know, looking after themselves, possibly going back into the workplace. So I'm hearing about that. And also, Dr. Reddy, you mentioned a lot about having these multidisciplinary meetings where everybody's all in a room together. I'm an early help practitioner. I've worked in early help for years and years, and it's just what COVID and lockdown has done has forced people into a room together and started to really pull together that early help agenda that's been around for years and years and years, but keeps faltering. But I think with the lockdown, we're seeing some real creative out of the box thinking about how we can reduce the amount of places people have to visit, and how we can sort of ease the burden on families of all these appointments, and to streamline everything and get everybody together. So that's really, if anything's positive that's come out of this awful lockdown and this pandemic, there's a couple of bits there.
Can I ask that, Dr. Reddy? So you were talking about sort of different training for parents in terms of whether toileting, sleep, or anything else. What we've seen during the pandemic, from the first lockdown, we've seen sort of two sides. One side is for the children who absolutely flourished when they were out of school. They were happy, they were contented at home and things like that. Having said that, there is also another side of a coin for those children who struggled during the pandemic. They struggled and they developed mental health issues and things like that. Will you have something about mental health as well?
That is actually a much bigger challenge than physical health at the moment. That's for all children and young people and adults. Clearly, that becomes even more difficult if you got a pre-existing condition, either autism, ADHD, or physical disability. Our CAMS colleagues are really struggling in terms of demand. I mean, they're already a big gap between what we could do pre-COVID and what is coming through our doors. There is a little bit of dribs and drabs of money coming from the center. Some of it is for the short-term clearing, catching up, and there was, for example, 350K for specifically for mental health problems in children with autism. So, and we all been asked to submit to, for example, to make autism services sustainable going forward. What staffing have we got now? How much more we need? And you've been part of this autism strategy group where we're all coming together. So people are expecting and demanding that we kept talking about this parity of esteem between physical health and the mental health in terms of workforce and beds, and that never happened. That is going to be a big short-term challenge. Actually, we got nearly quite a bit of new money come in. For example, for CPFT, we are recruiting specialist services for crisis care, intensive home treatment, and some money through the, we're talking about transforming care to prevent children with LD and autism ending up in either Tier 4 inpatient mental health or out of area schools. There's quite a bit of coming in. I'm sure whenever you spoke, you heard me talking about when I used to be clinical director for CAMS, it is not the money. We haven't got trained staff. That is the problem. It's not the money. We got a lot of money which we can't actually spend because we need to train people. And that's why I think people coming forward, voluntary sector, expert parents, training people to support each other with not your own time, but being compensated for that. The peer support programs, expert parent, that's where I think we can bridge that gap, really, I think.
Okay, thank you, Dr. Reddy.
So there is definitely the short-term money coming in to cope with, but people know that it has to be carry on and carry on increasing, and we need to train people. There's no point having money if you haven't got trained staff.
Yeah,
Yes,
that's
absolutely.
interesting,
It's
that.
just sort of the long effects of the pandemic can be quite daunting on families and children, because we've been in this for almost a year.
Yeah.
You know, and it's quite, oh sorry, my door, and it's quite scary, sort of where the kids will be left after this all, how
It
they will be
is.
able to cope. I'm sorry, I'm going to answer the door.
No, that's very much the biggest challenge we're seeing is the huge increase in the severe eating disorders that are presenting at the moment, and that is the biggest challenge. Clearly, OCD, self-harm, anxiety, that is going through the roof at the moment, because children are cooped up in their own bedrooms and there is nothing to occupy them. They're not having that social routines and the friendship support group and the schools, which are really good sources of support, and the exercise. Hopefully that will get a little bit better with the vaccinations, but it's just brought to the front what was a long-term problem of underinvestment in mental health services.
I think I've seen that when I worked in Devon, there was constant drives to recruit CAMHS practitioners.
Yeah.
And when they couldn't get CAMHS practitioners, they changed them to emotional health and wellbeing practitioners to try to
Yeah.
put in from different disciplines.
Yeah.
With like
Yeah.
a 9-month training program, they still couldn't get people.
And also it's a very stressful job, as you can imagine,
Yeah.
supporting young people, carrying the risk of self-harm and
Yeah.
suicidality, and supporting parents. And it's and if you got too many caseloads, they feel that they're not doing good enough job.
Yeah.
And that drives professionals into leaving jobs, really. I think we
Yeah,
need to support them, train them.
Can I just ask, Alok, you've been very quiet in the background there. Did you have any questions? I'm just conscious of the time. It's 1:30 now, so that's all right.
Sorry, I thought I had unmuted myself. I'm so sorry.
That's all right. Do you have any questions or anything at all?
Like talk about services and stuff, because obviously my daughter, she has PCD and she has many other health conditions, and what I have found is that she has tried to work as well, and what I found is that there's nothing there to support. And obviously she's at the age of 17 now, she's transitioning into adulthood, and I feel like the government have completely like just shut her out, as in like as in there was a healthcare professional who did come to see her, and she completely shunned her away and said, you know, these services don't apply to her. When I found that, you know, she struggles with everyday tasks, she can't complete things the way we would expect her to do. And when sometimes she gets really anxious, she starts getting breathing issues and stuff, and there hasn't been that support around like for many years. Like, of course, she's been attending appointments, she's been to Leicester Royal Infirmary,
Yes.
she's transferred there as well.
Yeah.
I have to say, like, she was assigned a nurse, Rajinder. She was actually really lovely, and she used to Skype her weekly to help her with her physiotherapy and stuff like that. But when I found, like, ever since COVID has kicked in and stuff, like,
Yep.
she's been, like, the doors have been shut on her. Like,
Yes.
just cooped up in her home.
Yep.
And I know that this has had, like, her conditions have had an impact on her educationally as well. So she hasn't been able to strive to the best that she could have if the support was there. Because I remember, like, when she was in primary school, she had a support nurse, a dedicated nurse. As soon as she went into secondary school, it was like, you're an adult now, you can cope on your own. And that's one thing I feel like is a very big issue in the Asian community. And obviously, like, as parents, we can't, like, we will strive to support our child the best we can, but obviously coming from an Asian background, sometimes we feel like we can't actually support our child in the way that we thought we could. And I really appreciate all of these services and everything, and these things that have come about to support them, to support children and get the help that Rabia didn't get. But I feel like coming forward, this is something that we should definitely look at as a group, as a family, and, like, you know, not as in family in the sense as in the family group, as in, I remember when she was younger, like, Family Voice really helped her, like, engage and make friends and stuff, and that's one thing that I found that supported her. But then once many people people started to come out of the picture is like those services have kind of died down, and I noticed that, like, I'm always checking the group chat, there's no facilities there like we used to have. And I think for all the children, that is, you know, something that we should strive forward, no matter what background, no matter what. Peterborough as a multicultural city should go forward and look at this.
Definitely. Definitely. I presume when you say PCDS, is it primary ciliary dyskinesia syndrome?
Yeah.
Yeah. So, I mean, clearly, as you know, I originally come from India, and I speak a bit of Hindi and Urdu. I can speak to you a few words. And this is one thing I'm very clear when I go to Cambridge, when people talk about services, Peterborough is different. And I work very closely with the Aiming High group, and we had some specialist meetings about genetics and consanguinity, cousin marriages, and the impact of how disability is perceived in some of our cultures and the families. And we actually had plans to go and talk to various elders and mosques and imams about disability in children and how to support. I think that's something we are very, very keen on. That's again, when we talk about digital solutions and IT, we are very, very aware of not everybody has got access to fantastic laptops and Wi-Fi. And if you don't speak English as a first language, all these things become out of the way. So we're very, very mindful of that. And we would definitely want to engage, especially for a BAME population. And for example, I'm leading a piece of research with Simon Baron Cohen, trying to collect 10,000 samples of genetics for children and the families with autism to understand how it affects different communities. So that's something we will be very keen to work with.
Just to let you know, I don't know if you're aware, and oh no, I'm not on mute, it's fine. We run seldom heard community forums. Yeah. So I don't think you've been to any of them, have you? We haven't invited you yet, I don't think, but in the future, we'd love to invite you to come to the Seldom Heard Community Forum. We are getting more parent carers coming forward from different groups, different communities, which is really good. The next two have been set, but you're always more than welcome just to pop in or just to book yourself on to see what it's all about. And, you know, great to have you there. But what we will do is when we're putting together some of the future forums, because they happen once a month, we'll certainly, you know, we'd invite you.
No, I think, Jan, what we can do is that this monthly forum, we can dedicate, specialize each one into something different. It would be one for Down syndrome, one for vision or hearing. We can bring other people and another one for seldom heard groups, so that we can rotate them around so that people feel that they can come and get something. And also you can tell me topics they want covered. Absolutely. They can ask for questions before, rather than me talking about it. Could be more of a discussion, really.
I think there are so many organisations working to do very similar things, aren't there? And it's about putting it all together and having an overview so that, you know, a parent or whatever only has to go to one forum and not several different ones. So if we can look at sort of mapping what groups are already out there, that would be brilliant. But we will be inviting you in the future. Thank you.
Good.
Mute myself. Any other questions? Because I am mindful we've gone over time. Everybody happy? That was brilliant. Really good information. Thank you very, very much. You'll be, Asta's back. Asta's got a parcel. Did you get a parcel? You're on mute. You're on mute, Asta.
You're on mute.
You're on mute.
Sorry, there was some mix up with the addresses. My name is not what they said, and I was like, I don't know what you want from me.
I would just open the box, and if it was anything any good, I'd have kept it. So, yes. That's me.
Do you know how many places I've lost because of that?
But thank you, everybody, for attending today. It's been really, really helpful. Alla, I will make sure you get a copy of everything that's been discussed. And as I said, this will go out onto our social media. Okay, it'll be on the Family Voice Peterborough YouTube channel. So okay, and can I also say a big thank you to Kirsty, who's been standing there in the background.
Thank you, Kirsty.
Like mad. So thank you very much for attending. And if there are no more questions, I will bid you goodbye.
Thanks,
everybody.
Lovely.
Thank you.